To the general public, they basically told them, at least in the SARS epidemic, to go back to two formulas. One was the Yin-Qiao San, which is a patent medicine became known as Yin-Qiao Jiedu San, or Sangju Yin. Now, both those formulas were invented by the same person, and they address wind heat into the surface. But to that approach, to add in things like Andrographis transhinlian, Isatis banlangun, Lanicera jinyinhua, Forsythia lanchow, and herbs like that. So all of a sudden, all over the country, stores were running out of those formulas. Since then, the recommendations have modernized more in the current crisis. The H1N1 flu, the Chinese are pretty much sticking to the same approach, but they're now looking at formulas like Ganmaling and Zhongganling and Yin-Qiao as the foundation formulas, which are very antiviral. They're sort of moving away from the Sangju Yin. So in 2003, China had a very good handle on treating SARS. SARS was a big epidemic. It lasted about 5 months. The total death rate was maybe 4,000 people, 5,000 people. Hospital workers in Hong Kong were being hospitalized. 20% of the hospitalizations in Hong Kong were health workers. This is because it was so contagious. So this was a bad one, 2003, the SARS epidemic. The new H1N1 is much milder. I think the panic is greater, but the actual severity of the disease in terms of symptoms is much milder. We're not getting the death rates that we had in SARS. However, like SARS, highly contagious, highly contagious. SARS, there was an incidence of a Chinese woman who flew from Hong Kong to Toronto, and she was quarantined at the airport. Before she was quarantined, 16 people also got SARS. So it was highly contagious. We're seeing the same thing with H1N1. What's happening now with H1N1, this is a recent virus, a flu virus. It started to rear its head in June, starting in Mexico. It's been identified. And now we're getting the outbreaks. And the Chinese say that, you know, summer is a good time for flu, fall is not such a good time for flu. That in fall, they expect the flu rate to increase. And they say the same thing for spring. With regular flu in the Western demographics, we think that winter is a bad time for flu. But now the contagion is happening. Lots of people are getting sick. Many of these are school-age children, middle school and high school, who are getting sick. There are definitely deaths associated with H1N1, but there are deaths associated with every flu. And this is usually the elderly. But, and newborns are at the highest at risk. These mutation flus can hit younger, healthier people. So we're seeing a lot of it in middle school and high school. The symptoms basically is an abrupt fever with chills and headache. That's sort of like the hallmark of it. The fever can be anywhere from 100 to 103, 104 in rare cases. I think the hallmark symptom is the chills, the shivering, and the headache. Now, within that group, there are some that report sore throat, some that do not report sore throat. There are some that report nausea and vomiting, others that doesn't appear at all. There is a test for it, and a lot of municipalities that are overwhelmed with H1N1 have stopped testing for it. They're just assuming that it's flu. From a Western point of view, they're not recommending much for most people that are sick. For those that need to be hospitalized, they're moving into things like Tamiflu and some expensive antiviral agents. If necessary, they're doing steroids, an inhaler, a respiratory support. But these are just for the people that are actually hospitalized. Many people go to the emergency room with this flu, but they're not kept and they're really not medicated. So that's sort of the situation, you know, now. And now I'm making this tape in October, and these facts will move ahead for a while. I think that we can look at this flu. However, I want to be very clear. We don't have Chinese medicines for H1N1 flu. We don't have Chinese medicines for SARS. We don't even have medicine for flu. We have medicines that are used to treat all these kind of infectious infectious fevers with chills, basically. And we divide it into a couple different types. We basically say there's a respiratory type. There's a high fever stage, there's a respiratory stage, and there's a damp stage. And different people present differently. So for practitioners of TCM, we need to know, we treat what we find. We don't have special formulas that just treat flu and don't treat other things. So what we're recommending for treatment, we have to look at two situations. One is what they're doing in China now. The other is what practitioners are doing here in the United States. First of all, in China, it comes down to, can the person self-medicate over the counter, or does he need a TCM doctor to medicate for him? Most people are self-medicating in China, and they're going for some common medicines that are available there, and they're available here too. And I'm going to put out what these are, because if you cannot see your patients or get medicines to them, they may be able to actually buy it in local stores, such as Whole Foods or Vitamin Cottage or even Chinatown stores. So I think that we have to determine, is the person sick, or is he just trying to prevent getting sick? If they're sick, if they're having fever with chills and flu, some good over-the-counter medicines and that they're recommending in China and that we have available here are both Ganmaling and Zhongganling. I think everybody's familiar with these medicines. Ganmaling is an interesting medicine. It sort of came into China in 1988. It had been a Taiwan medicine because the two lead herbs in there are from Taiwan and had not actually been used in China. You'd be very hard-pressed to find them in the traditional materia medicas. The Ganmaling had two herbs, Ilex Ganmegan and Evodia sanchaku. There's clearly almost 40% of the formula. The Evodia sanchaku is not related to the Evodia wujuyu, which is a very warming herb. The sanchaku is a very cold herb, cold and bitter. But Ilex Ganmegan and sanchaku are very antiviral, much stronger than the Yin-Xiao formulas, than the Linistra, Jinyan-Hua, and Forsythia Lian-Xiao that's in the Yin-Xiao formula. And as a stopgap measure, you can use Ganmaling. Other herbs in there is Chrysanthemum Juhua, which finds itself into a lot of the Chinese formulas for flu. Also, Isatis Banlangun and Linistra Jinyan-Hua are in there. Now, another formula that's like this is Chuanxinlian. Chuanxinlian is three herbs. It's 50% Andrographis Chuanxinlian, 25% Isatis Banlangun, and then 25% Taraxacum Pugongying. This is a very strong antiviral. And so the idea here, it's not really a Wenbing approach, it's a self-medication approach, which is to take herbs that are antiviral and to use those. So Chuanxinlian is a patent medicine that's available. You can use that. You can use Ganmaling. The last one that you can use is Zhongganling. Zhongganling uses another Ilex. It uses Maodongqing at 27% of its formula. It also has Banlangun in it. And Verbena mabiensal, which is another antiviral, herb with antiviral properties. The one thing that Zhongganling has that Ganmaling does not have is Pararia gugan. And Pararia gugan is good for the shivering. It's good for shivering. So this is how people are self-medicating. If your patients are in a pinch, you can have them take this. Now, as far as if you can customize formulas, there's a hospital in China, Ditan, which is in Beijing. Ditan Hospital is recommending just a 4-herb combination for treating the acute illness, which is Linistra, Jinyan-Hua, Isatis Banlangun, Mentha, Bohe, and then glycyrrhiza Gansal. 4-herb combination.